This is the District 214 College and Career Ready Night. Here, you're going to hear all about our health science career pathway from some of the teachers and students who do it on the daily. Okay, I think we have everyone. We're going to go ahead and get started. Again, good evening. My name is Kyle Burritt. I'm an associate principal at Elk Grove High School, and I'm joined here tonight with some other District 214 staff and a District 214 student. And again, they're going to do most of the talking tonight, and they're going to hopefully give you an overview of all the great things that happen within the health science career pathway, with kind of a focus on nursing careers and students who are pre-med. So that's who we're gonna hear from tonight. The first, I'm gonna introduce all four of our people, and then I'm gonna kind of ask them some questions individually, kind of based on their role in the building and what they do in the program. And then we're gonna hear again from a student in 214. And then after that, we may have some time for questions, but there is a second session after this. And if there's something tonight that you have a question that's unanswered, or if there's something you can't read on these screens, I'm going to share a few slides here. I would like to direct you to go to the District 214 discover214.org. All kinds of information are there, from the pathways, the early college center, new academic programs. There is a wealth of information there. It's almost too much sometimes, but I would tell you to go to that website, discover214.org. That's where you'll find some really, really great information. So first we have Melissa Solonsky, and I may have screwed that up. I was excited to meet her tonight because she's newer to her role as a health services supervisor here in District 214. So Melissa, why don't you tell us a little bit more about yourself, and before we get to the questions?
Sure. I'm Melissa Solonsky. I'm the health services supervisor here at District 214. I am a nurse. I've worked at Advocate Children's Hospital on the pediatric floor for 13 years and came into the role at District 214 in the role of the health services supervisor prior to COVID, so in August. So it's been interesting and exciting and challenging, kind of all in one.
Great. Thank you. The next up, we have Tim Meyer, who is one of our outstanding teachers coming from us. He works at Wheeling High School, and he's currently live from Wheeling High School. Tim?
Hi, everyone. Like you said, my name is Mr. Meyer. I'm one of the science teachers and health careers instructors at Wheeling High School. I've been in the district for 18 years, and prior to working at Wheeling High School, I worked as a certified athletic trainer for 2 orthopedic surgeons, assisted in the operating room. So I have a lot of OR experience, did that for 5 or 6 years. But I worked with our next person he's going to introduce, Miss Blank. She and I started our health careers program for the district back in 2009, 2010. And so currently I am teaching medical terminology, introduction to health careers, and honors physics for healthcare, all at Wheeling High School.
Great, thanks, Tim. And yes, the next teacher is Karen Blank. She works at the finest school in District 214, Elk Grove High School. A little biased there. Karen, can you tell us a little bit about yourself?
Sure, thanks, Tim. We did start the program many, many years ago, which is hard to believe. I've been in the district for 19 years, first teaching biology and physical science, and then moved over to the health careers track, and I absolutely love it. I'm currently teaching 4 medical terminologies and 1 intro to health careers. It's a fantastic program where we have a great team, and looking forward to answering questions about any of the programs at the schools. Hopefully we can help you out with that.
Great, thanks, Karen. Last on our panel, we have Olivia Sibu, who is a current student at Prospect High School. Olivia, we'll get to some more specific questions later on, but can you just say hi for now?
Hi.
Okay, great. Thank you. Thank you. Okay, back up to our resident nurse on the panel. We have some questions here, kind of surrounding around like a community partnership lens. Melissa, can you just describe what a typical day for someone in this field what does it look like for them?
Sure. Well, my current role right now, you can imagine with everything going on in the pandemic, has changed a little bit. So right now I'm responsible for all the communicable disease reporting to IDPH, the Illinois Department of Public Health, and the Cook County Department of Public Health. So communicable disease would be COVID or chickenpox or things like that. So I've taken on that role. I also work with different people at each of the high schools to facilitate communication and procedures related to the pandemic. I work with the health office staff to ensure that there's a safe environment. Now that we have to set up different isolation rooms for students that might be symptomatic. I keep the district up to date on all the guidance received from the Department of Public Health and Cook County Department of Public Health on a daily basis. So I do a lot of just updating and general guidelines and give guidance on what I learn. But the nice thing about nursing is it's very flexible. So I also work on call at Advocate Children's Hospital in the pediatric unit. And in that role, a typical day might include rounding with the doctors, handing out medications, and prepping patients for tests, taking their vital signs and things like that. So it's kind of a nice flexible thing.
Are there any, well, I guess like what trainings are necessary to obtain your first job in the field? Certifications, degrees, experiences? Well, what does a high school student need to know?
Sure. Most nurses obtain either an associate's degree from a 2-year college or a bachelor degree from a 4-year university. Many go further to get their master's degree in a variety of specialties, whether you want to be a nurse practitioner or an administrator or get into education. You can also get additional helpful certifications like CPR or pediatric life support. Or there's also certifications in different specialties like oncology, intensive care, and things like that. So, yeah.
This is the scariest question we have on here. If you could go back to your high school self, what would you tell yourself, and would that have helped you with your career?
I would tell myself to embrace every opportunity as a means to learn and grow, and not to be afraid to try new things. I think in high school, I was probably a little afraid to think outside the box or try something new if my peers weren't doing it too. But definitely every experience is, growth and opportunity. And it doesn't mean that it has to be a success. Sometimes you learn with those failures, and just be open to new experiences.
Okay. Skills or attributes that a candidate should have in nursing or health sciences?
I think problem solving skills are helpful in many areas, whether it's working with a family, soothing a patient, or assisting a doctor, also in emergency type situations. And I also think obviously caring and empathy, commitment to patient advocacy, really advocating for your patient and getting them what they need so that they can get better. Good communication skills, and really a desire and willingness to expand your knowledge. Nursing is always evolving, and treatments and policies are always changing. So you really have to kind of be open to learning new things.
What's one thing that a high school student could do to prepare now for a career in this field?
I would say now you could begin taking classes that are offered to prepare, such as biology, chemistry, anatomy and physiology. I remember my first class was a medical terminology class in high school, and I loved it. And that it had me hooked. It was just kind of, I knew it was going to be my thing. You can also look for volunteering opportunities, different certifications like first aid, or fields such as being a nursing assistant or volunteering in a nursing home. Just really, and take advantage of any preceptorships and mentoring programs that might be available as well.
Great, great, thank you. It's a good segue because I'm going to change the visual on the screen also, and then I'm going to talk to the two teachers about other courses that are unique to 214 in this pathway. And these are courses that you would not find at high schools. They certainly didn't have these back when I was in high school. And so we have kind of our career pathway visual on the screen now. And again, this all this information, I totally understand it's hard to read on the screen here. I would go to that discover214.org, the website where you can really get some great information. Because, you know, Melissa mentioned chemistry, biology, those core classes, which absolutely give you a foundation for all types of sciences. But Tim and Karen are with us tonight because they teach some very specific health careers courses and that they want to talk to you a little bit about. So I'll start with you, Tim. Can you describe, you know, a sequence of courses that you teach that students might be interested if they're interested in a nursing or a pre-med career?
So Miss Sawad, how do you pronounce your last name? Miss Sawadsky?
Sawadsky,
You
yeah.
got it right.
Sawadsky, thank you. I don't want to get it wrong. So Miss Sawadsky just pointed out biology, chemistry, physics, right? We have those obviously core subjects in our science areas. But then District 214 offers a health careers pathway program, which offers exactly what she just talked about. We have a 3 to 4 year sequence at all of our District 214 schools, which include introduction to health careers as a freshman, medical terminology. So your sophomore year then is broken up into 2 semesters. You have introduction to the healthcare field 2 your first semester, and then college medical terminology your second semester, where we work with Harper. So Ms. Blank and I are both dual credit instructors through Harper. And we teach that college medical terminology during the 4th semester of our program, which would be your second semester of your sophomore year. And you earn dual credit through Harper, through our classes at Wheeling, at Elk Grove, at Rolling Meadows, at Hershey, so forth. And then the 3rd year is our capstone course, our CNA. And so if you wanted to work in the medical field at any capacity, nurse, doctor, dentist, any capacity, we always say that the common denominator is patient care and learning how to work with people. So our capstone course is certified nursing assistant, which would allow you to earn your CNA degree, or you take the CNA class, you sit for the state of Illinois CNA exam, and then you earn your CNA degree as a junior in high school. And then your 4th year, you can take the course that, you know, I was just mentioning to you, we have honors physics for healthcare.
Mhm.
We have a dual credit anatomy and physiology course that we are now teaching on our campus. And that's dual credit with Harper. And then you can work after school as a CNA in a local extended care facility.
Mhm.
And then you go into college and, oh my goodness, all of a sudden you have experiences and a resume that no one else in the country has. And you apply to medical school, dental school, PA school, whatever, hey, you have it, whatever you want to do. And we've had students in our program earn direct admittance into nursing school, PT school, medical school, pharmacy, and not entirely because of our program, but it certainly makes a big difference.
Yeah, that's awesome. And there are some really great stories. Karen and has also mentioned how long we've been doing this. This is one of our, like, the OG of pathways in the district. And we have all of those stories are true about students being very successful when they leave. Karen, kind of a 2-point question for you, and Tim hit on these, but if you can give a little bit more detail. The credentials that are available for students in this pathway when they leave, and then also the dual credit opportunities. There's a lot, and Tim mentioned them, but can you just make sure that it's clear tonight how valuable the credentials and dual credit are for students in this pathway?
Sure. I think the biggest credential that they'll leave with if they continue on the pathway is that CNA, that Certified Nursing Assistant certificate. And basically what that allows students to do is work in those long-term care facilities, senior care facilities, and gain that patient care. So just to go back though to the intro and medical terminology, just to explain that a little bit, if I could. Intro to Health Careers is really a class where students are going to learn about not just the career pathways available. So I know this is a nursing and pre-med focus, but there's a plethora of different healthcare options out there. And so one of our goals during that year is to expose students to the different careers out there, expose them to anatomy, physiology, and then of course, medical terminology. The second year they continue that and then go into that medical terminology or college medical terminology where they can earn dual credit. This is a course that if you're going into healthcare, you'll take it in college possibly. You can earn credit here. And then that third year is that CNA, Certified Nursing Assistant. It's the only time in high school when you're going to be able to have hands-on care of patients. I don't know if everyone understands what this means, but students will be learning in the classroom with a registered nurse, and then they will have 40 clinical hours. 40 clinical hours. I just want to repeat that because it's a good chunk of time for these students to go out into our communities and actually take care of patients. And so that happens the second semester of the CNA. During that time, they learn 20 critical skills, and then we'll practice and be assessed on them during their time with the patients. And then that senior year, I don't know if Tim had mentioned that the final option, if you start the pathway as a freshman, you have that senior year, which is actually middle college, where you can go to Harper for most or all of your day. If you still need English credits or PE credits or history credits, you would finish that at your school, but then go to Harper, where you'd then be enrolled in health career pathway classes. So that's another way to get college credits while still in high school. So you could leave with one, two, three college courses under your belt. Is that right, Tim? Does that add up?
Yep.
Med term, CNA, and then if you go to middle college, actually you'd have more. You'd have what, 2 or 3 classes at middle college that could potentially count.
Yes.
So by the end of 4 years, you have a good leg up on many other students in high school.
In addition to any other AP classes that you otherwise take at school, AP Bio, AP Chem, some of our kids take AP Psychology.
Correct.
Some of the AP English and Social Studies classes too.
Yeah, that's great, and that is a good segue. Thank you both. It's a wealth of information about what the pathway really looks like when they're there. I'm gonna scroll up based on that information from Tim, and again, you will see on this slide, it's the courses that they're describing, Ms. Blank and Mr. Meyer. They're not in lieu of taking a science. They're not. It's not like, oh, I think I should take AP Bio, or it's really both, because by the time you're a senior, we're hoping this is where you found your passion. And with that, I'd like to get Olivia's lens. Again, Olivia joins us. She is a senior, I believe, at Prospect High School.
Yes.
And so, Olivia, I have some questions for you about the program, that kind of how you see it as a student. And Ms. Blank and Mr. Meyer kind of talked about these. So first, why don't you tell us what courses you're in, and then tell us about the learning experiences in those courses, especially outside of the classroom.
Currently, I'm in the anatomy and physiology class at Harper. So I'm taking anatomy this semester and I'm taking physiology next semester. And that has been really a great opportunity because it really was like showing me what I'm going to be seeing in the future, because I plan on doing pre-med, and that anatomy course was like that first step for me personally that really solidified that I really did want to do pre-med, because it was just nothing but human body, how it works, how like the structures, and I really figured out that I really like the course, and which is a good thing considering pre-med is a long commitment, and I think I'm willing to do that, willing to make that commitment based off of like how much I seem to be enjoying this class. And then I also took medical terminology, but I don't know if it's the same one that was part of the pathway, but I did take medical terminology at Prospect, and I took a human physiology class as well. And then outside of school, I volunteered at Northwest Community Hospital, and I worked on the pediatric floor at the nurses stations, which was really cool and interesting because I got to see actual patients. I didn't like interact that much with them, but I got to talk with nurses and doctors, and they really answered all of my questions. And I had a lot, which could have been annoying, but they did answer everything that I wanted to know. And there was just so much around me, like so much equipment and so many different personnel, and they were really patient and they answered all of my questions. And it was a really nice intro to the environment that I hope to be a part of in the future. So like there were some really great opportunities that District 214 offered.
Can you give me a little bit more about how the coursework you took in the different classes at Prospect, and how like you're even now applying that at either your volunteer work or it's your assigned work-based learning experience through Harper, something that you learned in any one of your classes at Prospect that you're really applying in the future workplace.
Well, for my anatomy class, there is a lot of memorization, and then there's just a lot of good content, which I know that will be really helpful for me in the future. Like we go through each of the different systems, and you need to have a thorough understanding of the class in order to do well in it, and therefore you have to put in a lot of work, but it's very beneficial because I know that I'm going to need this in the future. Like I need to know the human body, and the anatomy class is like it's teach. I think this is the class that I've learned the most in out of all 4 years of my high school career. Like it's been a lot of content, but it's been content that I thoroughly enjoyed, and I know I'm going to need it in the future.
That's great. Do you think now is kind of a yes or no question? Do you think now you're solidified into this is the career pathway for you?
I think so, because
Okay.
I'm really interested in the topics.
Today, what are your future plans?
Well, currently I'm applying to different colleges, but I'm going to major in, I'm hoping to major in chemistry or biochemistry, and then also do my pre-medicine prerequisites so that I could hopefully get into med school.
Great, great. That's awesome. Thank you for sharing some of your journey here with us tonight. Thank you. I'd like to jump back up and talk with the two teachers, and either one of you can answer this. And we don't have a whole lot of time left, but I want to get a little bit more insight into the day-to-day of what a student could expect in your classroom. And we can either talk a current classroom in a pandemic, or even a past and then hopefully a future classroom. So Tim or Karen, what could a student expect to see in either of your classes?
Well, can I jump in, Tim?
Yeah, please go ahead.
I would say we are actually very, very fortunate in the classes we teach, especially right now. These classes are actually perfect for an online situation, in that medical terminology, many of the parts of the course are learning the medical terms. And so the memorization, the reading, students have so much more time right now, and hopefully they're utilizing that to practice the terms, to memorize terms, and to use the terms. But it also forces students to do something that Mrs. Solonsky said about communication. And I just had a situation the other day that just led into one of those conversations about what are we doing and where do we want to go. And communication is so crucial, I think, in healthcare, as it is in so many careers, but it's especially vital in healthcare because it's the lifeline for many of these patients. If you're not communicating their needs, if you're not helping them, there's some tragic consequences. And so in these courses, communication is I think really emphasize and stress that you can't just not do an assignment because you don't know how. You need to email, you need to reach out, you need to ask for help, because that's what you would do in healthcare. You don't just walk in a patient's room, not know what to do and sit down and wait till someone asks you for help. So, as we look to students that are in these courses, we're looking for students that are proactive, that are go-getters, that are going to communicate. And so a daily class for us looks like an introduction, a warm-up, a group discussion, some individual time, maybe people are presenting or asking questions, and a lot of group work. Right, Tim? I would say a lot of.
Yeah, I would definitely to emphasize what you had said about communication. We have so many group projects because, we emphasize to the kids that no one in healthcare works alone. If you're a nurse, you're working with CNAs, you're working with other nurses, you're working with doctors. If you're a therapist, you're working with the patient's doctor, and maybe, there are just so many different healthcare providers that are functioning together as a team to treat any one particular patient. And so we do a lot of communication activities. We do a lot of resume building activities. We have mock interviews, right, Miss Blank?
I was going to get there. You jumped on.
Mr. Burritt is probably going to be in, doing some interviews in the next month or so, maybe 6 weeks, 8 weeks. And so my point here is, just like Miss Blank said, it is teamwork, right? It's all about teamwork. And yes, reading and writing is important. And yes, memorizing the terminology is important. But teamwork is also important.
That's great. That's great. Melissa Sawatsky, I'd like to jump back up to you and talk a little bit about if you have any other final thoughts. I know that I'm keeping an eye on the clock here. But I also want to know the current outlook of the profession. You're the one, you have the degrees and you are a nurse, as you said. What are your thoughts right now on and it's so broad, but like the current profession of nurses, doctors, anyone kind of in the medical field?
I think it's ever evolving. It's the good thing is it's never going to go away. We're always going to need people in healthcare, no matter what. It's a very, like they mentioned, it's always teamwork. I've never been alone in the job. I've always had a team of people helping me, which makes it fun and exciting, and makes you feel like you're not making a decision on your own. But yeah, I mean, it's evolving, it's changing, but it's always going to be there, and there's always going to be a need. I did just want to say to finish up that the one advantage of healthcare is it's a very flexible environment. There's so many jobs, and through my experience, I've done consulting, I've done bedside nursing, I've done discharge planning at the hospital, I've done school nursing, and now I'm in this role. And every role I've had has sort of flowed into the next one. And all that experience that I had, even from when I was got my CNA certification, it's all sort of tied together. And there's just so many options and so many different things you can do. If you decide to go into nursing and then maybe you switch over to do something else, a lot of those credits may transfer when you enter college. And so it's, for me, it's been, I've never looked back, and I've been very happy with all the moves that I've made and kind of the snowball effect it's had to where I am now.
Okay, thank you. That's
If I could also expand on
Yeah,
what
I was just gonna
just said. So Karen and I, Miss Blank and I, were just giving data on this to our kids this week. And the United States Census, so I'm looking at their website right now, says that the healthcare setting is still the United States' largest employer, with over 20 million employees nationwide and over 1 trillion in annual payroll in 2018. By far the largest employer than any other sector. So the retail trade was below that, but with 20 million employees, 15 million. Healthcare has 20 million. So healthcare has 5 million more employees than the next largest employing sector in the United States.
And I love that Mrs. Sawatsky talked about the flexibility within healthcare and the options. I think when we start, I think the best thing our district could have done is start this career pathway. And instead of students just checking off courses, what do I need to do to get out of here? Now students, I think, are engaged and excited and passionate about following courses that follow their passions and their interests. And so I don't know if you've ever seen the Bee Movie, very old cartoon, and the bees are looking at the board like, what do I have to do? What do I, they're looking and they're trying to make a decision on their career, and it's like forever, right? Because they're only living for, a few weeks or whatever it is. And I think when I tell my students, I'm like, it's not like the Bee Movie in healthcare. You don't just have to sit and pick one career and that's it. Mrs. Swatsky said it perfectly. I have many friends in healthcare, and they go from this to this to this to this, and not with a ton of extra money or extra education. I mean, some, yes, you can go get your master's and it's 2 years or 3 years, but there's some where it's a training or a certificate or, just a little bit of a specialization, but there's so many options and choices in healthcare. And I do love that we're focusing on nursing pre-med. That's great, but there's so many careers out there. So very exciting that we have so many participants, and hopefully we'll be seeing you in our classrooms.
That's great. I did want to see if I have a kind of a boss tonight who's behind the scenes. It is Erin Teresi, who is our dual credit. She's all things dual credit for the entire District 214. And this pathway in general has a lot of different opportunities for students. And I wanted for her to chime in, if she would, for a moment to see, is there anything from a dual credit lens and a pathway from any of the admissions criterion to anything that we should have parents know tonight?
Well, I'm actually getting a lot of questions about, how can students join the pathway, and what happens if you're a sophomore or a junior and you're just coming to this now. And I think from a post-secondary lens, that's the best part about our Pathways program. Students who decide after their freshman year that they're not interested in manufacturing anymore, or whatever pathway they might have tried out freshman year, can join this pathway. And, the courses that we're talking about here are highly transferable. So you're earning credits while you're in high school that will apply. I think a lot of parents and students get tripped up on the fact that our dual credits are through Harper College. It doesn't necessarily mean that you have to go to Harper. You can absolutely transfer those courses anywhere that you want to go. It's always up to the receiving institution on how they'll be applied, but I'm sure that Ms. Blank and Mr. Meyer have a ton of students who could speak to how much money and time they've saved by taking these early college credits. So that's just another cherry on top of this pathway, that we do have so many other opportunities. And I know we talked a lot about nursing and pre-med, and that's one of the pathways we have. But obviously some of the coursework differs if you want to go into something else in health science. So if you're interested in learning about the allied health field, and some of the other courses that we have available in a similar but different pathway, we have another session after this that we encourage you all to join. But yeah, I hope that helps with the post-secondary.
Can I jump in, Erin?
Yeah.
Sorry, I just want to grab you before we're ending in a few minutes, but really important question that you had asked. We have been stressing this whole freshman, sophomore, junior, senior, this sequence, right?
Mhm.
I think enough information has been out there for the last few years that we felt like we could push it to freshmen, so, et cetera, and people would be in for the 3 to 4 years. But like you said, there are students that started other pathways that by their junior and senior year are just not fulfilled with those pathways and jump over. And I actually think I've seen a lot of leadership and a lot of interest out of my juniors and seniors because they are so close to college. So yes, it's great to have a freshman that's just beginning, but it's so cool to have a senior that jumps in the pathway that says, I think this is what I want to do. They really do a great job for the most part in the classes. So if there's juniors out there that aren't quite in the pathways yet, and you're like, well, I just have one more year, jump in, at least try intro to health careers, see what the terminology is like, be exposed to different careers, and at least get your feet wet before you leave high school.
Yes, and it's just as important to figure out what you don't want to do. I learned that the hard way in college with 7 majors. So I absolutely
Oh.
encourage all of you to take
7 majors.
7 majors, but I graduated on time. But I do encourage everyone to take advantage of the Pathways program in some way. And your counselors are really an amazing resource that you have available to you that can help you through navigating the Pathways program. So if you are interested in health science, please reach out to your counselors.
That's great. Now we know why you know so much about college and dual credit, because you've taken every
Right.
course possible. Thank you. Thank you for sharing that. No, that's great. We are running short on time, and I want people to have an opportunity to meet the next session. As Aaron was saying, there is a session 2 to this night. But I do want to thank all the panelists for sharing their stories and their lens tonight. We really do appreciate your time. And if you do have more questions, you can always reach out via email. And on that website, I'll push it again, that discover214.org. Lots of different information, and then it can kind of help you navigate not only the pathways, but then to the people who can help answer the questions as you start making decisions for your future. So thank you very much, everyone. This concludes the session, and I hope to see you in another session here in a little bit. So thank you.